Hi guys, Dr. Luster here today, and today I would like to talk to you about Webster certification and what is it for and what does it mean. Webster certification is pretty cool because it is a technique that is specific to pregnant women, and you can also use some of the application of it to children and pediatrics as well. But it is specific to pregnant women, and you get it from the International Chiropractic Pediatric Association, the ICPA, and they have a whole bunch of different seminars and classes and techniques and stuff that you can take related to the treatment and management of pregnant women and pediatrics. Not a ton of people have this certification, which I think is a shame because, I see pregnant women a lot in practice, and knowing how to treat them, I think, is significant because you have to respond. They require different things than just anyone coming in. I mean, chiropractic will help anybody, and most general chiropractors know how to, at the very least, adjust gentler and stuff for chiropractic and where they should focus a little bit. But ICPA took it one step further with the Webster technique. Webster technique is a technique that incorporates a bunch of changes that are happening in the pelvis and tries to help your system accommodate those changes better. So your system is trying to relax and open this pelvis up to really get ready for baby to come out, right? So a lot of the times the back pain and pubic bone pain and stuff like that are experienced as a result of those changes are actually the system not handling the changes super well, and we can fix that, or we can help that, I guess I should say, rather with chiropractic care, specifically the Webster technique. Now, the Webster technique incorporates a couple of things, and they're all very specific and very, very helpful for that. A lot of it's tissue work, and some of it is adjustments, of course. So the first part is called basic technique, and basic I actually have a whole video talking about because it's something I do fairly regularly because it is the technique of the school that I went to, Logan Basic. Anyway, so basic technique is significant for helping relax the entire pelvis and lots of parts of the spine, and it works really, really well for pregnant women because they have all of those hormones going through their system and whatnot to help them relax. So basic technique is the first part, helping balance the pelvis, the sacrum, the coccyx. Those are important because we want to make sure that those are out of the way for when baby tries to slide out. So making sure that those are mostly in line and helping them stay balanced and move well is important. Of course, balancing the pelvis in general, and any parts of the low back that are connected to that, of course. Now, and then flipping them over and working on the pubic bone, which also often gets stuck because as your system is your pelvis is tilting a little bit forward to allow you some more room for baby to sit in there. It can be very, very painful for your pelvis to tilt forward like that, and so pubic bone adjustments can definitely help relieve some of that, which is important to help you have a better, easier pregnancy, but then also to make sure that when it is time for baby and you really are expanding that pelvis open, that it's expanding smoothly. Then there's also the round ligament adjustment. Round ligament is something that is a ligament that really is stretched out and is affected by having that pregnant belly there, and we can help release some of that tension in there, which actually provides quite a lot of relief for some of the pain that's going on there. And then there is, of course, the psoas. The psoas is a muscle that connects your rib cage to your pelvis, essentially, and it's pretty important because it is kind of like the opposite of your low back muscles. So when your low back muscles are super tight, then the psoas, you compensate by having the psoas being looser and being able to try and respond to that, but over time it becomes harder, and so then you don't really have much movement anymore because your psoas and your low back now are super tight. So releasing the psoas and then releasing the low back, they tend to help each other to do that. The psoas specifically is important because, again, we're trying to, as the pelvis is tilting, we're trying to provide more release into that muscle there so it can tilt easier, and the low back pain can relieve as part of that. There are a lot of other little aspects of that, but I was trying to keep them fairly concise because it really just depends on the person, and you can have a whole variety of different symptoms and whatnot as a result. Webster certification is a pretty cool certification. It really, I've seen really profound effects with the Webster adjustments, and I highly encourage you to see Webster certified doctors if you are pregnant, just because it is really, really, truly important and very underrated how important it is to have your pelvis in line appropriately for when you do give birth and welcome that new life into the world, because it doesn't have to be extremely horrible. It doesn't have to be an agonizing 9 months of pregnancy and whatnot. We can help you with some of that, and then of course with a lot of that, you also want to make sure that you're adjusting some of the rib cage, because the baby's kicking those ribs out and whatnot, and that can be very painful. We want to make sure we're adjusting that, and also of course the neck and whatnot, to make sure that you're all as you go into some of this, because it's a lot that you're doing. You're really taking a lot on in your system, so definitely making sure that we can make you as comfortable as possible, and Webster technique is a great technique to do that. If you have any questions, definitely reach out. We would love to be able to help you along your journey with this, and I hope that explains some things, and you have a good one. Thanks, guys.